it is 30-degree angle. Okay, the sacrum is formed by the fusion of the sacral vertebra, 5 sacral vertebra. So it has a body, apex and 4 surfaces: pelvic surface or ventral surface, dorsal surface or dorsal surface, and then we have the 2 lateral surface. Coming to the body is, you see, wide and it articulates with the 5th lumbar vertebra. Anteriorly the body is very prominent and it is called the promontory, sacral promontory, and it is at a 30-degree, like this you have to hold. Then either sides we have is a wide fanciped ala of the sacrum, which is formed by the fusion of the transverse process and the costal process of the sacrum. The ala, if you see, medially it is smooth and laterally it is rough. So medial smooth part will give attachment from lateral to medial to the oils. Lateral to medial oils. That is obturator nerve, oil, iliolumbar artery, lumbosacral trunk and sympathetic chain. Then we have is the lateral part will give attachment to the iliacus anteriorly, and posteriorly it is going attachment to the lumbosacral ligament. ऊपर का हो गया. Now pelvic surface we have ridges. These vertical ridges, 4 vertical ridges signify the fusion of the bodies of the lumbar vertebra. Then we have is the ventral foramina, ventral or pelvic foramina. These will ventral foramina and dorsal foramina, ये जो है sacral canal उसके साथ meet करता है, communicate with the help of intervertebral foramina. Now you will find in here this in E-shaped manner there will be attachment of the muscle piriformis in the pelvic surface. Now coming to the dorsal surface. Dorsal surface you will find many crests are there. So this is the median crest. Median crest shows the fusion of the spinous process of the vertebrae. However, you will find, and this is this part, flat part near the median crest is a fused lamina. So here you will find, due to the failure of the fusion of the lamina of the 5th sacral vertebra, very important, failure of fusion of lamina of 5th sacral vertebra, there is formation of sacral hiatus, and this is the articulating processes, and failure and this free articulating process on either sides of the sacral hiatus are called sacral cornua. Sacral hiatus, failure of fusion of the 5th sacral lamina of 5th sacral vertebra, and this is the inferior articulating faces around the sacral hiatus, sacral cornua. Then we have is the median crest, fused lamina. Then we have is the tubercles, you will find dorsal tubercles. These are the articulating fusion of the articulating facet to signify kore. Then this is the dorsal foramina, and this lateral crest is formed by the fused transverse processes. So then here attachments. So here in U-shaped attachment there will be of the erector spinae muscle, and in the concavity of the erector spinae muscle there will be attachment of the multifidus muscle. Coming to lateral surface we have is the upper part, lower part. Upper smooth part is giving attached joints with the sacroiliac joint to form the sacroiliac joint, and the lower part it will give attachment to 4 things: gluteus maximus, sacrotuberous ligament, sacrospinous ligament, coccygeus muscle. This was that. Then coming to the sacral canal. So sacral canal opens through this is formed by the foramina present in the body of the sacral vertebrae. So sacral canal जो तो है opens in the sacral hiatus. Now sacral canal से क्या पास करता है? Your phylum terminal, then chorda equina, phylum spinal meninges, and lateral sacral arteries, lateral sacral vessels. Then phylum hiatus से क्या निकलता है? Phylum terminal निकलता है, sacral nerves and coccygeal nerves. This was only for the sacrum.